From Difa, a town southeast of Niger, we travel on a road to get to the refugee camp in Sayam Forage, some 50 kilometers or 1 hour by car from here. Because of the security situation here, we are driving in a convoy. The region of Difa is indeed under threat by the jihadist group Boko Haram. On the road to Sayam, we cross small villages, camps for displaced. The savannah is interspersed with cattle and sheep. As we get to the end of this landscape, we arrive in Sayam. We are some 1,400 kilometers from Niamey, the capital of Niger, and some 50 kilometers from the border with Nigeria, where the refugees come from, fleeing from violence. According to the HCR, there are today about 17,000 refugees and displaced living in this camp. The management of Sayam Forage, which covers 17 hectares, is a daily challenge.
Most of the times, the population's needs are for revenue-generating activities. They are mainly Nigerian refugees, and these populations used to live by labor and sweat before being evicted from the territory they occupied. When they came here in 2015, they were handed out all the necessary assistance, and they were first of all embarrassed. They were embarrassed to accept help, and they would ask for revenue-generating activities. And the NGOs who were there had started by providing training for revenue-generating activities. So there was, for example, sewing, soap making, vegetable farming, fish farming, and all these activities from which there was training were implemented in the camp. But there is still a lot to be done in terms of empowering refugees.
Mais il reste encore beaucoup de défis à relever en termes d'autonomisation, surtout des réfugiés.
It's in order to respond to these numerous challenges that the DK39 project has been set up since January 2018 in the Lake Chad Basin, mainly Niger and Chad, by the African Bureau for Western and Central Africa of the UNFPA, the United Nations Fund for Populations. Financed by Denmark at $1,500,000, this project aims at reinforcing the resilience of the communities around the Lake Chad Basin through the investments in youth and women. In terms of empowerment, the beneficiaries have benefited from tailoring cutting with machines to do so. Others have opted for peanut processing. And it's interesting to note that these activities have been chosen by the beneficiaries. So these are not activities that were forced upon them, but rather we sat down with the beneficiaries and we asked them what do they want to do in terms of activities? Can such and such activity help them? What can we do? So we gave them different options and then we analyzed them to see to what extent they were feasible. Because the beneficiaries could want something, but if it's not possible to do the activity, we will reconsider or reorient them to another activity. All these activities, it was with the community who chose them. So the tailoring, sewing, peanut processing, livestock farming, they have chosen these themselves, and they see the results and keep on saying, we are happy, and these activities have enabled us to cover certain costs. Ayesha Adamu is one of the women in the camp who has benefited from an income-generating activity. At home, she transforms peanuts in oil and press cakes. She sells them on the village market, and the earnings enable her to provide for the needs of her family. This activity has helped me a lot. It has helped me look after my family. It's thanks to this activity that we can eat, buy clothes for my children and myself. At first, we were given peanuts and equipment. I don't even know how much it is worth. It's when I started selling processed peanuts that I realized the importance of this activity. Today, thank God, I can earn a living. This is the health center in Sayam Forage. This morning it is crowded. There are some 50 women who are waiting to see a doctor or a midwife. Does the center have the means to meet the needs of this amount of requests? Apparently, yes. These last months, the capacity of the health center in Sayam has been strengthened by the DK39 project.
L'appui a beaucoup changé parce que la maternité.
The support has helped us a lot because it has provided the maternity ward with birth kits that were here, Congo kits, and a lot of other inputs. So this has changed the way we are caring for pregnant women and those who are sick. It helps us with the delivery and all the other checkups. It has really helped in everything related to the care and the quality of the care that we provide.
Vraiment, ça a beaucoup amélioré la prise en charge et la qualité de la prise en charge.
The midwife in the Sayam Health Center helps about 3 women each day to give birth, working day and even night. Indeed, power cuts are today a problem of the past. The delivery room has electricity and light and is fully equipped thanks to the DK39 project. The midwives and the nurses have also benefited from a training in the care for emergency cases of obstetric fistulas, such as immediate hemorrhages, of the postpartum, as well as the prevention and the management of the shock related to it. So what we do here every day is when we come at 8 o'clock, we do a visit with the doctor. We go and see the women who are pregnant and admitted here. We then look at what we need to do for the day. We see if there are any women who are about to give birth, and then we would help with that. Then we go to the maternity ward. I get the report for the pregnant women. If there are women who are very sick, who have malaria, for example, then I will care for them. Then I go to the CPNR, the prenatal ward. If there are women who have come to give birth, then I will care for them and assist. If there are any newborns who are ill, who had returned home, for example, newborns who are 28 days old, then I will care for them.
Depuis que le projet a débuté, le projet a beaucoup apporté pour la maternité.
Since the project has started, we have had a lot of benefits at the maternity ward. The ward has benefited from a lamp that helps with neonatal resuscitation. Apart from that, we have also had beds that really helped in the midwives with the care. If there is a good equipment, then the midwife has optimal conditions to do her work, which was not the case before.
La sage-femme, elle est vraiment dans de bonnes conditions pour travailler, ce qui n'était pas le cas vraiment avant.
The beneficiaries are rather happy. About 140 of them benefit each day from the different health services. Here, there are mainly refugees and displaced from the camp, but also some from the local population. We lived in Nigeria before coming here. We had difficulties to access health services because we lived in a remote area. Having access to health services as a refugee in Niger is a positive change for us. The center is open for us refugees day and night. When we are sick or when our children are sick, the personnel is always available. And we have medications. When we are satisfied of the service, we let them know. And when we are not satisfied, we tell them as well, so that they can improve it, or so that they can evacuate a case to Difa. And for that, an ambulance is available, as well as health personnel to accompany the patient. This other health center in Sayam Forage is dedicated to prenatal consultations and family planning. Here, the project has mainly helped with the availability of contraceptive methods. Thanks to the sensitizing activity, the number of women who have adopted a family planning method has increased in the camp. In average, 10 women come here each day for consultation. I came here for my prenatal consultation. The midwife had me do all the necessary checkups. She took blood samples to test for HIV, malaria. She gave me medication, iron, another medication against malaria. She also took my blood pressure and reassured me that it's normal. She also gave me advice on my pregnancy and on nutrition. Some meters from the health center in Sayam is the multi-purpose center. Here, cases of gender-based violence are looked after. Psychological care is provided as well as women empowerment initiatives through income-generating activities. Kado Ibrahim is a center manager. He hears traumatizing stories on a daily basis.
Par rapport au partage, c'est un truc très confidentiel, mais je pouvais parler un peu d'une manière.
So what I can share, well, it's very confidential, but I can speak to you about it in a brief way. We had one case that arrived here. It was a young girl who had been taken by the gangs. She had spent about 2 years with them and she had an unwanted pregnancy. So we made sure we cared for her here. We then referred her to the healthcare center for the follow-up on her and ensure a good pregnancy with the doctors. This is a brief one story, but there are many others. If I should tell you about all of them, I would take the whole day here.
Je peux passer toute la journée en train de parler des histoires comme ça.
3 women, 3 stories, and one common denominator: gender-based violence. Rape, domestic violence, neglect have marked their everyday life for months. Today, they have regained their smile. When we left our village because of the attacks, I lost sight of my husband. A while later, I found out he was in a different area. I went there 3 times, but he didn't look after me. Even to return home, he didn't pay for my transport pass. With the children, I was lost. I didn't know what to do to manage our needs. Once here, I started attending the multifunctional center. After that, I benefited from revenue-generating activities, which enable me today to meet the needs of my family. When I arrived here, the center helped me first of all with providing me with a dignity kit. I then got trained in sewing. With the other survivors, I started to enjoy life again. Today, I feel much better thanks to the discussion groups as well. It has helped me forget about what I have been through. At the beginning, I used to sell water here in the camp. I would go and fetch wood in the forest even though it's forbidden. But I didn't know where my husband was, and I had the children to look after. What I was earning wasn't enough to meet our needs. When I came to the multi-purpose center, in addition to the psychosocial care that I was given, I was also provided with a training in income-generating activity. Since then, I don't sell water or wood anymore. In Sayam, gender-based violence preoccupies many. Domestic violence, rape, early marriage, school dropout rates for girls are some of the many themes affecting the children of the camp. It's with that backdrop that we leave the Sayam Forage camp. Back to Difa. The town's Mother and Child Center benefits from the support of the UNFPA. It cares for complicated cases from the Sayam Forage and from other localities of the Lake Chad Basin. Aida, as we will call her, is only 13. She has suffered a week ago a rape that will mark her life forever.
Qui a été violée il y a une semaine de cela, dans une région très lointaine.
She was raped a week ago in a very remote area in the Lake Chad area. And for this young girl, it was very difficult to ensure her health care because, as you know, we normally have the World Health Organization rotas who are here. So it was the first rota that caused us trouble because they took 1 week to come here to be able to provide health care. So this girl has been raped with penetration, and during the medical examination, we saw that there was an important tear and a tear in the posterior perineum. So this girl has been raped with penetration, and during the medical examination, we saw that there was an important tear and a tear in the posterior perineum. So we operated her for 2 or 3 hours in the surgery. That is an example to say how complicated it gets here. Fortunately, the UNFPA is here to support us, and thanks to the support in terms of material and in terms of medication, the PEK kit in terms of vaccination, were able to care for this kind of situation. As for this girl, if it hadn't been for the support of the UNFPA, I can tell you that it would have been difficult for us to provide the care she needed.
The Mother and Child Center receives many cases of obstetric fistulas.
Cela est dû tout simplement, comme je l'ai dit, à un retard, n'est-ce pas, dans l'accès.
This is due to a delay in the access at the healthcare centers. The workload there is heavy. There are also, how we could call it, cultural aspects, which means that quite often people will go to the traditional doctor, and these are our habits, our culture, which slows down access to health, which means that we really have a great number of cases here. But we limit ourselves and we only provide treatment and care for simple cases of obstetric fistulas. We started operating in 2012, and from that date to today, we have had a lot of cases. And quite often, there are cases that exceed our capacity. So those cases are usually referred at the camps where there are healthcare services for obstetric fistulas, most often organized by the UNFPA. A month ago, or 2 or 3 weeks ago, we were in Maradi, and we took there 4 of our patients who were cared for at the camp.
Quelques semaines, 2 semaines, 3 semaines, nous étions à Maradi et nous avons en tout cas amené 4 de nos patients qui ont été également pris en charge au niveau de ces camps.
Vous avez fait une visite au camp de Sayam. Vous avez vu comment
You visited the Sayam camp and you saw the impact on the healthcare and how it has evolved in the structure. Many things have improved, and that is thanks to a new way of training which involves helping mothers survive and helping babies survive, which is funded by the Bill and Melinda Gates Foundation and with support from the UNFPA. And this training aims at reducing the level of maternal and infant mortality in the society. We want to reduce that level in a drastic way. So how do we do that? We focus on the most frequent causes, which are hemorrhage, the preeclampsia, and of course we focus also on newborn resuscitating to help the newborns. We also care for the old babies. So this training is called a little dose, high frequency.
Some 711 kilometers from Difa, we stopped by Maradi. The economic capital of Niger hosts a training course for law enforcement agents in preventing and caring for cases of gender-based violence. This activity is part of the UNFPA initiative aiming at ending GBV in the country. Police officers and soldiers from the whole region of Niger, except for Niamey, are part of it. The trainer is helping them in particular to create in their different services an environment that is favorable to communicating with persons who have been victims of gender-based violence.
What happens is that people are poorly received in our institutions in Africa. It's not only the case in Niger, which leads to the fact that quite often the survivors, the victims, don't want to go to the institutions. So I insist on the importance on the first contact when the survivor arrives. So the way they are receiving is important, but also what is important is the reception space or room. You can't receive a server in a corridor, for example. This is where I encourage the public powers, the United Nations, etc., to help the institutions to set up spaces where the victims are receiving, so these are received in adequate spaces. And the skills to perform the reception are important, so as not to contribute to re-traumatize the victims. So two things: reception and correct audition with a lot of respect and empathy to be able to write a full record that will sustain strong lawsuit and that will help the public prosecutor to do his work.
Depuis notre arrivée, le lundi,
Since we came, since Monday until yesterday, we have been in the psychosocial and medical care at the reception for GBV survivors, where they are victims of different kinds of violences, different cases. We try and see which ones are most urgent, to see how to treat them. We try and build trust and find solutions.
La formation est venue renforcer déjà mes capacités sur le terrain, puisque je m'occupe surtout du volet.
The training has reinforced my skills on the field, because I used to be in charge of women protection, and in particular protection for minors in the region that I represent. So this is an added value for me. It's the first time that I am part of a training on psychosocial care for victims of gender-based violence. And for me, this training has strengthened what I already have. It has enabled me to see violence from different angles. We got to see films, and these were shocking. They gave me a feeling that I wasn't participating fully. I wasn't assisting fully these women. So now I am able to strengthen my skills that I have taken from the field, but also I'm able to fight for it to stop.
De non seulement renforcer ce que j'ai déjà sur le terrain et de lutter pour que ça cesse.
In Niger, the UNFPA works with several local and international partners on questions of gender-based violence, early marriages, women empowerment, amongst other topics. In Sayam, for example, this collaboration has led to rather satisfying results from the point of view of partners.
Encore une fois, le Niger qui ouvre ses portes, qui ouvre ses bras.
Once again, Niger has opened its arms and welcomes a strong value that is at the center of an important political program. And where there are these forced displaced persons, you will find organizations in the camps like the PAM, like the UNFPA. And these really bring a relief, not just a relief for the HCR, but a relief for women and children in the field of GBV. In the fields of reproductive health, health in general, infirmary equipment. The list is long. It's a strategic partnership and a sister partnership that has the same objective as ours, to implement all the concepts of the philosophy of care, which is the safeguarding of a person's dignity.
Dans les perspectives, nous avons des modèles.
As for prospects, we have models. This project targeted essentially Chad and Niger. Chad stood out with a promising practice, which is community response. That is, the response of the communities by the community, and for the most vulnerable cases and the survivors of gender-based violence. And as for DFAD in the refugee camp, you saw a first-degree integrated care service at the first service provider. And this service leaves no one out. So this model of community response and service provider points should be scaled to the regional platform, which includes 4 countries: Niger, Chad, Cameroon and Nigeria.
Le Tchad, le Cameroun et le Nigeria.
The DK39 project has now come to an end. Many of the observers wish, however, that this project, which has had convincing results, may be renewed.